Pulmonary embolism is the second most common cause of cardiovascular death after myocardial infarction and stroke. And it's the second commonest cause of sudden cardiac death after cardiac arrest. Yet, in India, we are not geared enough to treat these emergencies. To discuss this, today we have Dr. Peter Clemmensen from Hamburg, Germany. He is representing the Acute Cardiovascular Care Association of the ESC. Welcome, Dr. Peter.
Thank you very much, Vishal.
So, what do you think? How do we improve the care of these patients?
Well, I think first of all, I would like to thank you for taking this initiative and putting pulmonary embolism on the stand here in the program, because it's so important. And like you said, this is a very common and underdiagnosed cause of death worldwide, not only in India. We know from European and US studies that a lot of these patients are undiagnosed and they die without a cause. And we know that from autopsies, which we don't perform that often. But even in the past, we know that our pathologist came back and told us this was a massive pulmonary embolism that was the cause of death. It wasn't a heart attack, it wasn't a stroke. So you're completely right, this is underdiagnosed. What we should do is think of this diagnosis in everybody who present with chest pain of unknown origin, those who don't have ST segment elevation, who might have some troponin, those who have discomfort, dyspnea, and I think, in the forefront, in the emergency room of those that are under suspicion of having a pulmonary embolism is, of course, an acute echocardiogram to see if the right ventricle is dilated. And then, of course, you have to, if any doubt, to do a triple rule out with a CT scan, a CT angio, to rule out aortic dissection, but also pulmonary embolism. You get so surprised in the emergency room when you realize how many patients actually are affected.
Great. So in your presentation yesterday, you also discussed about the importance of pulmonary embolism response team, or the PERT. So, and we don't have this concept in India. How important it is to manage these patients?
Well, I think it's very important once it's established, but if it flows, they call the right people, but it's really important that you have a team of experienced anesthesiologists, acute cardiac care physicians, and the cardiologist, if those are the one who have to decide on lytic therapy or a mechanical thrombectomy. So I think the PERT team, in its early stages, creates awareness inside the emergency room and also the hospital that this is an important diagnosis to identify and treat early.
Great. So you mentioned the treatment part also. So what do you think is the current advances in the management of this disorder?
Oh, this is a great question. I think we've known, but it took a long time, that thrombolysis actually works. Although we don't have mega trials to confirm this in terms of prognosis, we know that it improves patient symptoms early on, and it reduces the load of the right ventricle. And we also see, cases where it actually is life-saving. What is now emerging is really pivotal trials that test mechanical thrombectomy, but also direct, catheter-directed lysis in these patients. And this is really wonderful. We should have had these trials 10 or 20 years ago, but I'm really happy to see it's coming. This is what I see the greatest advance in the therapy right now. So get the diagnosis and, really a directed therapy with lytic therapy. If you are in a hospital where you don't have the access to mechanical lysis or a catheter-based lysis, at least you should know that you have thrombolytic therapy. It works in those who have a massive or even a submassive pulmonary embolism.
Thank you very much. That's very informative. Thank you for being here, and enjoy the meeting and stay here.
Thank you very much, and thanks for having us.